Hey guys, welcome to my Monday Night Live, 7 p.m., where we talk, where I answer your questions about anything holistic. So ask me a question in the question box every Sunday or Monday. I try to put up 2 of them. That way I can answer your questions and we're all ready to go. Okay, so welcome to my live. Thanks for being here every Monday, 7 p.m. Tell your friends. If you have family members who need help but can't see me personally for whatever reason, this is a great place to get a nudge in the right direction for free. Okay. All right. So I think we're waiting on one more camera to go live and then I'll start answering questions. We are good to go. Welcome everybody. Thank you for joining me. All right. First question is a good replacement for soda. Couple of thoughts here, okay? A lot of times when I ask my patients to go like less sugar or less bread or less grains or less gluten, everyone's like, oh, well, I need a replacement, right? Because there's a bit of a mental addiction to a lot of these foods. And I guess my challenge to you would be like, why can't you learn to go without it? Why do you need a bubbly sweet drink? That's my first point. I think you should break the habit and learn to do without, right? Because it's not good for you. And so if you need something to just substitute something that's not good for you, it's like if I don't know, okay, this is extreme, but it's like if I would be like, well, I really love alcohol. What's like a good substitute for alcohol? Well, could I just stop drinking alcohol? Like, I don't know. Like, I know soda is not as bad for you as alcohol, but that's kind of my example. So of course they're making there's like a natural alternative for sodas like Olipop and Poppy, and I would say those are a step in the right direction, but they still have sugar in them. One of them's in a lawsuit for false advertising in terms of its claims for benefits of health on your body. So a lot of these brands, they're just like greenwashed and whatever. I also don't really like kombucha for soda replacement either, because kombucha is made from SCOBY, which stands for symbiotic culture of bacteria and yeast. So a lot of times we don't want to be yeasty. So we don't want to add a lot of more yeast to our gastrointestinal tract, our mouth, our bladder, whatever, right? So I don't recommend drinking kombucha every day. So, I mean, I don't know. You could do like sparkling water with, which you're not going to like because it's not going to taste like soda. You could do sparkling water with like lemon or whatever. But I don't know. I would try to drink water or use a little bit of pomegranate juice and add some sparkling water to pomegranate juice. That would be pretty tasty because we talked about pomegranate juice last week. If you didn't hear my spiel on pomegranate juice, or maybe it was 2 weeks ago, can't remember. It was entertaining. So yeah, that's my answer to the replacement for soda question. Ty asked a question. I think I answered this last time too. She loved my liver cleanse. Thank you for loving it. I'm glad you felt great on it. I'm doing it again in January, and I'm actually having a Black Friday bonus opportunity that I'm going to be releasing. So if you are interested in doing my liver cleanse in January with the group, and you want a little bonus just for you from Black Friday, do it. Watch out for that. I'll be talking about it everywhere. If you're on my email list, you'll get an email. So a supplement to keep it going. I really like SP Cleanse from Standard Process, which is on the link in my bio. You could also do, that would be a good one. I would take probably like 6 a day. I'm a high pill count guy because in my pills, it's food, and sometimes you need a bit more volume of food to move the needle and create change than a prescription drug. So that's that. You could do that. That's probably what I would start with. SP cleanse, because it's going to keep those detox pathways going, which is what the liver cleanse does for your whole body. So I hope that helps. Ty, did you get it? Let me know. All right. Let's see. Next question. Thoughts on Simplex F for regulating hormones postpartum? Yes, it's a great product. So Simplex F supports the entire female hormone. It's like broad spectrum hormonal support for females. And then there's also Simplex M, which, as you may guess, is broad spectrum hormonal support for males. But I want to see. So in Simplex F, they're specifically targeting and supporting the ovaries, the adrenals, the pituitary, and the thyroid. So pituitary creates all the hormones. She says, Ty again says, thank you. Highly recommend the Love Your Liver Cleanse. Yeah. We have raving reviews, everybody. I haven't had a negative review about it. It's awesome. Anyways, back to hormones. Well, if you want to support your hormones, do my liver cleanse. That'll help a lot. But the PMG, so Simplex F supports the ovary, the adrenal, the pituitary, and the thyroid, right? So ovaries, obviously, postpartum, they've worked hard. But pituitary, so after you have a baby, you have a drop in hormones that happens very drastically more than any other time in a woman's life. You're going from this amount of hormones, that's where a lot of times those side effects of postpartum depression or other strange things happen because there's such a drastic change. So yes, Simplex F is a great starting point. And if you just want to do like one product to provide a lot of support to the hormonal system in a female, it's an excellent product because you want to support the ovary, right? You want to support the adrenals. You want to support stress. You want to support the pituitary, which is the gland in the brain that sends signals to all the other hormones in the body. And then you want to support the thyroid, which has to do with energy, metabolism, right? And thyroid and adrenals kind of go hand in hand. They hold each other's hands. So yes, to answer your question, I love that product. It's a great general support. If you're still having problems postpartum, we might need to get more specific because the Simplex F might not be enough. Okay. But that's good. And yes, it is breastfeeding safe. It's only food. So if you can eat food while you breastfeed, you can consume most standard processed products. You ask me about MediHerb. So herbs are different, but most standard processed products, except a couple of them are just food. And so you can consume while breastfeeding very easily. So yes, it's breastfeeding safe. Someone says, what can I do to support weight loss 12 months postpartum? Weight isn't budging. All right, weight. So there are 3 things that drive weight. Okay. There are 3 hormones that stimulate the body to hold onto weight. Insulin tells the body to basically push fat into the tissues, okay? And then there's cortisol, which packs on weight around the midsection especially. And then there is estrogen. So those 3 things. So if those are all too high, you will carry too much weight. And then there's also a bit of toxicity that's involved as well. If you have just a lot of toxins in your body, that can cause that as well. But so if you're postpartum 12 months, weight isn't budging, something's wrong. I would recommend doing a Dutch test or a Vibrant Wellness Hormone Zoomer test to see exactly what's wrong, because those will test the cortisol throughout the day, and they will test all your hormones, which is really excellent. It does not test insulin, so I would order a blood lab of insulin for you as well to see which one is the main factor for you. But in general, you could start, because if you want to support estrogen and cortisol, you could start with Simplex F, because those will support those 2 things. It doesn't tackle the insulin marker as much, but that would be a good starting point to see, by giving those areas or regions some more support, will you see improvement? I don't know, worth a shot. So that's where I would start. Okay, someone's asking about kidney stones and they developed gout. Well, these 2 things are very connected, because when the kidneys are not filtering out the blood properly, there's a lot more waste product in the blood, which then leads to gout. That's the Reader's Digest bird's eye view overview of that process. But basically, it doesn't surprise me. It's a male, 56 years old. So what he needs to do, you need to support the kidneys. So there is a product called Chanca Piedra, or there's the name brand of it. It's called Bodyguard Supreme from Supreme Nutrition Products, which is a link in my bio. I would start that. It's nicknamed the stone breaker. So basically taking that can help break up kidney stones. However, you could also do something called phosphate liquid from Standard Process. The reason why is because calcium, which is usually the mineral that's accumulating in the kidneys to make the kidney stones, it helps get dissolved by phosphate. So by phosphorus. Phosphate liquid has more phosphorus in it, so that can help get into the bloodstream and dissolve the kidney stones. So that would be a way to approach it. If you want to do something a bit more invasive, you could do shockwave or soft wave, I think is what it is. Yeah, shockwave lithotripsy is what it's called. That is an option. So that sends a beam of sound to break up the stones in the body, which is kind of fascinating. But anyways, so after you break up the stones, you need to support the kidneys because the kidneys aren't functioning well. I want some more information. I want to know what his GFR rate is. GFR is glomerular filtration rate, which just tells you how quickly the kidneys are processing and filtering the blood. How functional are the kidneys at filtering? Which is a good thing to know, because if that's a low score, that means it's a really slow filter, and that's not helpful. And there's ways that we can get that up. So I've gotten people out of kidney failure before with natural supplements and got their glomerular filtration rate from like low considered kidney failure to back to optimal normal, usually within a few weeks. It's amazing. So some of those products to help with kidneys, that can help with kidneys, to support the kidneys recovery, right? It's not treatment, but it helps the kidneys do their job, is Rena Food from Standard Process, or Albaplex, or Arginex, or Renatril from PMG. Okay, those are the ones that I would use. Arginex, when you first start taking it, it's a kidney detoxifier. Albaplex as well, a little bit. Your urine will actually be a bit more odorous in the beginning because it's making the kidney expel all the buildup, which is great, right? For someone who has a low GFR, we want to get all the gunk out of the kidney so that so they start working better. Let's see. What else to tell you about that? I think that's pretty much it. But as you clean up the kidneys, the gout symptoms will become much more manageable. So that's pretty much what I have to say there. All right, next. Someone asked me how my mango tree is. It's doing great. I can't wait for it to make mangoes again next year. They're amazing. Anyways, someone else asked how to heal dysbiotic gut. This is contributing to my health anxiety. Okay, well, dysbiotic gut. So what this means, dysbiosis. Okay, dysbiosis means dysfunctional biology, basically, or microbiome. So her microbiome is imbalanced. When that happens, you get a lot more inflammation. You have a lot more bad guys than good guys. You have maybe yeast or fungal overgrowth or bacterial overgrowth or even viruses living in the intestinal tract, right? Or parasites, right? Or a combination of all of that. Yes, we need to level the playing field. So what I would do is basically, I always talk about the gut as like an apartment building. Okay. When you have an apartment building and you're not taking care of it, and you're just not even checking on it. If you own this building and it kind of falls into disrepair, you're not going to be able to charge this amount of rent, right? You're not going to be able, you might have to, this sounds like, it's just life though, right? If you have a not high quality place, you might have tenants that are not as ideal, okay? And I'm not saying everybody's like this, is just a generalization, okay? But basically, you need to fix up the gut, okay? So what we need to do is what I like to use is antimicrobial herbs. So some of my favorites, there's a one called golden seal. That one's really great for the microbiome. There's also another gentle one that you can take on an empty stomach before bed called Zymex 2. These are all from Standard Process at the link in my bio. But Zymex 2 is like my gentle bowel rebalancer. It's also a very gentle anti-parasitic, which is pretty awesome. But if you take that on an empty stomach, it will help rebalance the microbiome and help heal dysbiosis. When dysbiosis is healed, you should notice a difference in your mental health and your anxiety, because whenever you have a lot of inflammation in the gut affects the vagus nerve, which causes inflammation in the vagus nerve, which goes up to the brain, which causes inflammation in the brain. Leaky gut or dysbiosis gut, because when you have dysbiosis and everything's inflamed and everyone's fighting in there, it creates inflammation, which creates leaky gut. When you have leaky gut, you have leaky brain. When you have leaky brain, you have an inflamed brain. When you have inflamed brain, you are more prone to anxiety and depression. So everything starts in the gut. All autoimmune disease, I think most mental health conditions, most joint pain, most cardiovascular conditions start in the gut. Gut also meaning oral microbiome, all the way down through the throat, down through the other end, right? I mean, it's proven in the research that certain bacteria in the oral microbiome affect the heart, right? So, can cause you to have more risk of heart disease. So yes, heal the dysbiotic gut. I think it is contributing to your health anxiety. Start with Zymex 2 on an empty stomach. Add some golden seal throughout the day if you like. If you're in pain, any gastrointestinal pain, whether it's upper heartburn, whether it's lower pain, I love to use chlorophyll complex. You can't overdose on it. There's no herb in it, so it's pregnancy and breastfeeding safe. But chlorophyll complex, if it's upper pain, you even bite it and you swallow, like it's kind of like a gel capsule. So it will make your teeth and mouth temporarily green. Don't be alarmed. Just flash a pretty green smile and go on with your day. Basically, the chlorophyll and also has sesame seed oil in it. Those two things are anti-inflammatory, anti-pain, and they help build your blood. So I'll use this for people with upper digestive discomfort or lower digestive discomfort, and it's very helpful. So that's a couple of places to start. Number 7. What have you seen to be the best solution for long COVID symptoms and recovery? All right. So yes. What COVID does is it hurts your mitochondria, and because all viruses do that, they hijack your cells, they steal your energy. That's why you feel tired when you have the flu, right? Or when you have a viral infection, you feel deep fatigue. It's because they're stealing your energy. So long COVID is very similar, and I usually put people on broad spectrum immune support like Immuplex from Standard Process, and then also an antiviral like Viranon or St. John's wort. Those work really well. And then the other thing with long COVID is we need to drain out basically all the debris caused by the viral infection. So there are different drainers that we could use. There's a couple of homeopathic ones. Garlic is a natural drainer of a viral infection. So you can do that in a tablet or a capsule, or you can eat a lot of garlic if you want. I like just taking the tablet, Garlic Forte from Standard Process, because the amount of garlic you need to eat is kind of insane to get the same clinical benefit. So that's where I would start. Anything that helps heal your mitochondria would be great too. Also, like phosphatidylcholine, like from Body Bio, would be really great to help repair the mitochondria and the cellular membranes from long COVID. Arginex too, which I also mentioned for kidneys. But the reason why Arginex is great is because it has a lot of what's called rutin in it from buckwheat, and rutin helps repair blood vessels and the vascular lining of basically the lungs or the heart, right? So that would be another place to look as well. That's pretty much my protocol right there. So if you do that, so let's review. Immuplex, you're going to do like 8 a day. Viranon, you're going to do like 6 a day. Garlic, you could do 2 to 4 per day. And then Arginex, I'd probably do like 6 a day. I would try that. That's what I've seen a lot of success with long COVID. If it doesn't work, reach out. You just might be more tricky, and we can try other things. But that's what I would do. If someone still hasn't recovered their smell 100% post-COVID, what does that mean? So usually it can be extremely zinc deficient. I've seen some zinc restore smell after COVID. However, if it's been a long time, there could be enough nerve damage where it doesn't completely come back. That's part of the problem here. And if it is nerve damage, what you need to do is nerves healed with B vitamins and healthy fats. Of course, there's more things involved, but those are two of the main things. So one of my favorite B vitamins to help heal nerves is just Cataplex B from Standard Process. It has B6 in it. Helps heal the nerve. And then I like Ulprima EPA DHA for the omega-3 component to help heal the fatty sheath or the casing around the electrical wire that is your nerve. So I would try those things if it's a nerve issue. If it's a viral issue because the infection is still there causing problems with the nerve, then do my long COVID protocol that I mentioned previously. Okay, so I hope that helps with that. Someone asked, what can I do if I have PCOS and painful cramps? My liver cleanse. It will help tremendously. Okay. I have never had someone's cramps not improve from doing my liver cleanse ever. Never had someone not improve. I had one person, well, some people don't get cramps. Some women don't get cramps ever again after doing it once or twice. Which is cool. They're like, oh my gosh, I only knew it was here because I was timing it on my app or whatever. Right. So that's pretty cool. So that's something to do. And then with PCOS, we have to think about two things that are dysfunctional, okay, or out of balance. PCOS, you're insulin resistant. So that means your blood sugar is like, right? And we talked about insulin being one of the things that makes your body pack on fat, right? So that's why PCOS, usually women with PCOS struggle a little bit with weight. So what we need to do is we need to fix the insulin resistance, and there's lots of ways that we can do that. But the liver cleanse is great because it will help the liver handle sugar and food better. And when the liver and the digestive tract handles food and sugar better, you have less burden on the insulin portion of the body. So that's why that ties in there. There's other things we can do to improve insulin resistance. Gymnema is an amazing herb, actually. It comes in a tablet, but you could break it, put a tablet on your tongue for like, I don't know, 30 seconds, just like suck on it real good. And then take it out, try tasting something sweet. You can't taste it. It anesthetizes or makes numb your taste buds so you can't taste sweet, which is really cool for those who struggle with sweet or sugar cravings because it just takes away that problem entirely. But also, Gymnema goes in and it looks at all the cells and it's like, hey, little cell, you have little insulin receptors on the outside of your cell that look a little overused or broken. Gymnema goes in and repairs those broken insulin receptors. I had a patient, let me find this because it's really cool. One second, I got to pull up his file because I can't remember the exact number, but I was measuring his insulin, okay? And let me just tell you, here it is, I'm almost here. So a healthy insulin, like, first of all, if your doctor doesn't measure your insulin, I would ask why, because insulin resistance, which is like when insulin starts going high, because your body has to make more to get a response, right? That's insulin resistance. I have to make more to get the same response. That's a problem, right? So when insulin is being made in higher and higher amounts, and the body needs that high amount to get a response, that's insulin resistance. We need to bring that down. Okay. So I had a patient, his insulin, a healthy insulin is like 8 to 14. I like to see it under 8. That would be great. But under 14, I'm okay with. I had a patient, his insulin was 62. Okay. And he struggles with his weight. And his insulin is 62. So his body is screaming insulin, right? Which also screams and tells his body to pack on fat, okay? Which is not what he wants. So I put him on Gymnema, which was pretty cool. And within like a month, he got down to 39. Okay, we're not where we need to be yet, but we went from 62 to 39, and that's like, over a 20-point difference in a month. That's awesome. So that's just a little testimony to Gymnema, which is pretty cool. So I would look into that for PCOS. That's where I'm going back to. Polycystic ovarian syndrome. So PCOS, polycystic ovarian syndrome. Scholars also call it ovarian diabetes or diabetes of the ovaries, right? Because there's that insulin resistance that's fluctuating that's also impacting the ovaries, which is what's causing the hormonal imbalance. The other component of PCOS is high testosterone. When testosterone is high, symptoms of PCOS include like a little bit of a mustache, right? Just imbalance in the female presentation. So we need to get the testosterone down. So the way I would support the hormonal aspect of PCOS is with honestly general hormone support. Chase tree would be great. Ovex from Standard Process would be great. Ovarian support. And then adrenal, you could do adrenal tonic, adrenal complex, Drenamin, all these things would help. So anything you can do to help lower your blood sugar, so like a paleo style diet, maybe even keto for a season, and then anything for hormonal health, my liver cleanse, because it'll help balance the hormones. It'll help your body regulate the amount of estrogen, progesterone, and testosterone by treating the liver, and then it'll help the blood sugar too. Okay, so that's PCOS. What are my recommendations for dealing with scoliosis? It depends on how bad the degree of curvature is in your spine. If it's really bad, there's not a lot you can do besides bracing and potentially surgery. I have a patient with a she had a really bad scoliosis. It required surgery. She's only 21. She now has a back fusion from C5, base of the neck, all the way down to her sacrum. So all the way down to her pelvis. So she has rods down her entire spine. And then what happened was one of the rods broke. One of the screws is now exposed and scratching and rubbing on her tissues all the time. So she's in intense pain. Nothing's worked. She started seeing me. I've seen her a couple times. It's been amazing. Because I put her on my PEMF beds, and because when you have rods, I can't like crunch her, right? So, or adjust her, I should say, in a normal way, in a crunchy way. But I can do low force work. So I've been doing low force, so no cracking, and then PEMF. And I believe it was after her second treatment, she went on over a mile walk for the first time, and we don't even know how long. Her dad was telling me, and so excited, and he was just like, I cannot remember that last time she's walked that far. So she comes in like 7 out of 10 pain. After working with me for about 10 minutes, she's at like a 4 or 5. We put her on the PEMF. She gets a little better. She goes off. We see her again next time. So that case is still just in the beginning, so I'll keep you posted on it. But that was a pretty interesting scoliosis case. But anyways, for you, to help you with scoliosis, sorry, sometimes I just get sidetracked with stories. I hope you find them interesting and not boring. But either way, I'm going with it. What was I saying? Scoliosis. If it's too bad of a degree, like I said, you're going to need to work on it surgically, maybe bracing. If it's not too bad, it can be managed with regular chiropractic care. So that's my answer to that. Someone asked, what are some lifestyle diet changes to address hypothyroidism? Excellent. Well, I need to know what kind of hypothyroidism. Is your thyroid not functioning because you have an autoimmune disease called Hashimoto's? Well, Hashimoto's is when your immune system is going crazy because there's something in the thyroid, and so it develops an autoimmunity to the thyroid. And so if we don't calm down that inflammation and that immune, your thyroid will get caught in a crossfire, and it will continue to decline in function because it's getting shot in the face by your immune system, okay? So if that's going on, then you need to avoid gluten unless you want to continue to pour gasoline on the fire. You need to take Thytrophin PMG. That's like my main autoimmune thyroid support. It is a general thyroid support as well, because all the products in the Standard Process that are ending in PMG are like a warm fuzzy blanket for that organ to give it time to just like be by yourself, heal, work through things, right? So that's what I'll do for the thyroid. But if it's a pituitary problem, for example, the pituitary is just not talking to the thyroid enough, then that would be a different treatment, right? If it is a lack of nutrition problem, like you don't have enough selenium or iodine, and so your thyroid just can't make the hormones it needs because it doesn't have the raw material coming in to shift around and make thyroid hormone, that's something else. Also, thyroid or slow metabolism or the effects of a slow thyroid can be because of your liver, because the thyroid makes T4. Okay. So yes, you can ask as many questions as you want on this live. I'll try to get to them all. But the pituitary, okay, makes a hormone called TSH. TSH stands for thyroid stimulating hormone, and it goes down to the thyroid. It's basically telling the thyroid to do its job. Rev at this rate, right? Produce this amount. So the thyroid's like, okay, cool, pituitary, I hear you. Well, that right there can get messed up. If the pituitary isn't yelling loud enough or talking loud enough, the thyroid can't hear it. So is that happening, right? Then if the thyroid's just like so tired and not working, the pituitary has to yell really loud to get the thyroid to do something. And so TSH is a measurement of how loudly is the pituitary talking to the thyroid, and is it talking too quiet and that's a pituitary problem, or a hyperthyroid problem, or is it talking too loudly because it's a thyroid problem? So that's where the first nuance comes in, right? Secondly, the thyroid makes T4 mainly. T4 is the inactive form of thyroid hormone. Basically, it doesn't really do a whole lot. T4 then swims down to the liver, where the liver converts T4 into T3, and T3 goes out into your body, and it's the active form, and it makes you have metabolism. Every cell in your body has a thyroid T3 hormone receptor. Cool, right? Well, that's where if your liver is really backed up because you haven't done a liver detox ever, or you're just an American who's like eating crappy food, right? The liver's going to be like, well, I'd rather detox all these toxins out of me first before I deal with the thyroid hormone, because I don't want you to die from all the poison in your body, right? The liver prioritizes what's important. That's why whenever you drink wine or whenever you drink alcohol, it affects your hormones or it affects your sleep, because your liver's prioritizing detoxing you so you don't die, right? So that's a great problem to have. Well, I mean, it's not a great problem to have, but it's a great order of operations, right? So if your T4 is normal, but your T3 is low, that's a liver issue. So then you need to work on your liver. So in terms of hypothyroidism, well, is your T3 low? Is your T4 low? Is your TSH high? Do you have TPO antibodies? Do you have thyroglobulin antibodies? Do you have reverse T3 problems? Do you have free T3, free T4 problems? So like whenever I ordered a thyroid panel, I'm ordering like 8 markers, right? The average PCP orders maybe at most 3, unless you like really push for it. Usually they just measure TSH on like post checks. But that's why I ordered TPO almost every time, because I want to see how well are we improving the rate of autoimmunity in Hashimoto's. And that's when my patients get better. And some of them, through their PCP or their endocrinologist, are able to get off of their synthroided levothyroxine, which is pretty awesome. So anyways, hypothyroidism, get off gluten, make sure you're getting enough selenium. If you don't have Hashimoto's, make sure you're getting enough iodine, and do liver work. Let me know if your thyroid condition is autoimmunity. That's pretty much it. Someone else asked, mom suffers from macular degeneration. Any support advice? I would do a lot of antioxidants. So macular degeneration, you could try bilberry. Let me just make sure I'm thinking about the physiology of this problem. Yep. Degenerative condition affecting the central part of the retina. Yep. So I would do bilberry. You could do bilberry. I think it's bilberry forte from Mediherb. That is potent, filled with antioxidants that are specifically helpful for the eye tissue. You could also do oculotrophin PMG, which is that PMG for the eyes. Give the eyes a warm, fuzzy blanket so they can potentially heal. You also want to look at inflammation. So turmeric forte or Cyruta Plus. I would probably lean towards Cyruta Plus for the eyes. You can't go wrong. You could do both. But the reason why I would say Cyruta Plus is because it also really supports blood vessel repair. And a lot of times eyes, they're a place with a lot of really tiny blood vessels, and the tiny ones get hurt first, right? Just like people. Just kidding. But out of left field, sorry guys. But the tiny blood vessels get damaged first. And so if you can provide more nutrients that heal blood vessels, that's going to help. That's going to give the retina a healthier blood supply. With a healthier blood supply, there's more oxygenation, and you can get those antioxidants of the bilberry forte to the eye. So that's what I would try for macular degeneration. Yeah. Well, guys, that brings me to the end of my questions. I hope that helps. It's great to see all of you. Thank you for joining me. And I will see you. I will not be here next week, okay, because I will be at a conference learning pediatric and infant cranial adjusting, so like working on the skulls, which is amazing. And then, of course, spinal adjusting as well for the same population. Do you know, guys, this is crazy. I was doing some of the coursework because we have online videos before the in-person meeting, but someone said, what can be done for, sorry, I'm just looking at all these different questions. I just saw a little question box. Okay, what they found was basically, okay, babies, right, and humans, we have this fluid that washes our brain. It's called CSF fluid. Like if everyone's ever had like a spinal tap, right, or if you've heard of meningitis, right, that's an infection in the meninges, which is like basically tissue in the central nervous system that keeps the fluid around the brain. Excuse me, sorry. Basically, when the cranium is like a little squished or the skull's a little squished or not in the right spot, it doesn't allow the proper flow of that CSF around the brain. What they found is there's a correlation between children who have a lot of that fluid accumulating around the brain, not like encephalitis numbers, but just abnormal. But there's a correlation between that and neurodevelopmental disorders like ADHD, ADD, and autism. So basically, the premise or the question is, if infants and children got cranial work and spinal work and adjusted, first of all, you would help their brains immensely because you're going to promote that fluid circulation. And when the fluid circulates, it cleanses the brain and the nervous system. And when the nervous system is cleansed, they can grow and have proper development, right? But when there's that imbalance, they have more neuroinflammation, and neuroinflammation is the driver of a lot of those conditions. So anyways, that's my rant about that. But I'm excited to take the course, but because of that, I will be traveling. So I hope to do Monday Night Lives next week. So I'll see you in 2 weeks, but submit your questions whenever I see it. Whenever I post it, I'll still post a question box for next Sunday. We'll just do them in the following week. So thanks, guys. Have a great week. Talk to you soon.